As a provider with the mobile health program for over 13 years, I can say my personal experience has been such that for every developmental age of a child, living in high crime areas where there's low income and there's poverty, there is some component of that impacts health and health outcomes. Let's look at number one, brain development. If a child is living in a situation where there's toxic stressors could be hunger, it could be lack of housing, it could be exposed to violence in the family, in the household, it could be exposure to death. All those things are stress to the development of the brain of a child. Oftentimes, children who are living in low income or poor neighborhoods may deal with hunger during the summer months. That's a big problem that I think oftentimes we don't recognize, that children during the times that they're not in school may not get the school lunch or the school breakfast. So they're often very hungry, and when they're hungry, they tend to eat non-nutritious foods. And eating non-nutritious foods can lead to overweight and obesity. So we're dealing with the epidemic of overweight and obesity and all the negative outcomes that come from that, as well as poor control of asthma and learning disabilities. That's just a couple of examples of things that I see frequently in my patient population. We've been in existence in the District of Columbia now for 20 years. November of this year will be our 20th anniversary. And we actually started as a replicate of a national program known as the Children's Health Fund, which was started in 1987 by Erwin Redlener, a pediatrician, as well as Paul Simon, the singer. They saw in New York City there was a high number of homeless children who did not have access to a provider. So they were able to raise funds to get these RVs outfitted into a doctor's office on wheels. And they would take these RVs to these homeless shelters to provide service. Part of the success was shown that when the families transitioned out of the homeless shelters, they would actually come back just for their medical care. And so they were able to replicate that model. And in the District of Columbia, we've been practicing that model of care. We provide medical services on our mobile units, dental services on our mobile units, as well as disaster relief.
We provide comprehensive dental care, which includes examinations, x-rays for diagnostic purposes. We do restorative dentistry, which is fillings. We see patients that have insurance or patients that are not insured. So we never turn anyone away. Our doors are always open. And we reach out to the community in a lot of different ways. We have outreach programs where we do presentations on oral health, and we try to show the community how important your oral health is because it affects your general health. And you know, your oral cavity or your mouth is a good window to your general health.
Children's National Medical Center has been very committed to working in the community. We have health centers in the community in Northwest as well as Southeast, but one of the, to me, standout components of the hospital and their commitment to the community is our mobile health program, the ability to go where historically providers are not able to go and to address the need of underserved communities and bringing quality health care to families, doing preventative care, well child care, education, and making the medical home a model that families embrace versus acutely just using the medical profession just for emergent care, but realizing part of raising a child is addressing their oral health needs, their mental health needs, as well as their physical needs. Nutrition starts from when the child is in the womb. And so we have to teach every man and woman of childbearing age the importance of feeding the child in the womb, proper eating during pregnancy, proper nutrition during the first months and year of life, because most children pick up the habits of the adults in the household. And so one of the most difficult things to do as a provider is to sit with a parent and a child in the exam room and say, this is what you should be eating, this is what, and then they leave and all of that information goes out. Not because they don't realize the importance, but you have to look at the limited budget, the fact that mom and dad may be working jobs and not have the ability to prepare fresh meals, or they may not be able to have the sit-down family dinner that's recommended. Kids may not get meals in the home, but someone else is preparing the meals for them. So there's many different aspects of proper nutrition that sometimes is outside the control of the parent. We do a lot outside of just delivering care. We do a lot of adult education in the community about very common diseases, because we're hoping that the education that we provide the adults in the community will change their knowledge and thus their behavior, and children will model after that. For me, I think one of the key messages I want to send the public out there is that Children's National is actually trying to make sure that we reach the community. Make sure we have providers that are able to access those children who don't have easy access to a provider. And that's why the mobile health program has been so successful. We are the arms and the legs and the community presence for Children's National, and we can proudly say that we've been providing services to historically underserved communities for 20 years and doing it very well.